How long does Marina last? This one's my favorite. The actual quote is, for as long as you want for up to 5 years. What does that mean?
If you want to get it taken out, you can.
If you want to get it taken out, you can. What else could that mean? Can you get it taken out and get it immediately put back in?
Yep.
You don't know?
Yep.
So can I just continue to use Marina, get it taken out, 5 years, use it, 5 years, take it out, new one, 5 years, 5 years, 5 years, 5 years? I have no idea, right? Nobody knows. I took it one way, my friend took it a different way. I thought that you could have it as long as you wanted, like 2 years, 3 years, 4 years, up to 5 years. But she thought differently, right? So it was very unclear how long Marina actually lasts, right? Was there anything else unclear about this commercial? Yeah?
It didn't say like the other problems that could happen. You could attach it to your, like what problems? Like
Yeah, just other problems. Don't worry about it.
and then like they didn't go into specific what they said your body's prone to. They didn't say once you put it in, this is gonna bring in a lot of things.
Yeah.
Infections.
Absolutely. So, trying to analyze an advertisement in depth is not something that the general public is doing, right? It's something that you guys are forced to do because I wanted to do it today. But think about what your patients are learning through these media outlets, right? And there's one other way that we learn through the media, and that's entertainment education. And entertainment education is how we embed health-related information into popular media narratives to try to educate the public, right? So your textbook talked about this, the Hollywood Health and Society organization. This is their website. It was actually super interesting clicking through a lot of these tabs, so if you have a moment, go explore a little bit. It talks a lot about how they try to make sure that in TV shows like Bones, Law & Order SVU, Grey's Anatomy, all the medical shows, Scrubs, they try to actually use medically accurate information because they understand that through these theories that we talked about, they can change and alter the attitudes and behaviors of the population, especially related to health information. So take a second to go to that website when you have a minute. And these fictional storylines can come in the form of things like television shows or public service announcements. So, this is a 2016 Partnership for Drug-Free Kids updated PSA. So it was probably our parents' generation that were notorious for the "this is your brain on drugs" kind of PSA. And they took it and they updated it for a different frame now that those people have aged and probably have kids.
And this is drugs. This is your brain on drugs. Any questions?
Yeah, I have questions.
Prescription drugs aren't as bad as street drugs, right?
Weed's legal, isn't it?
Drinking is worse than smoking weed.
Isn't it? Why do you
It's heroin is so addictive.
Well, it just makes you feel happy.
I have questions.
Mom?
Dad, did you ever try drugs?
They're going to ask. Be ready. Go to drugfree.org. A message from Partnership for Drug-Free Kids.
And they also embed this information into television shows.
Sorry to bother you with this, Chief. We've got kind of a situation.
What now? 3 interns, 4 residents, and 6 nurses on the surgical floor have been diagnosed with syphilis.
There are over 70,000 new cases every year. Undiagnosed, syphilis can lead to blindness, insanity, and death.
If you are having unprotected sex with another member of the staff, get tested. This is not a request. Patricia will now give you a safe sex demonstration.
When the time is right, and gentlemen, you all know when that time is.
Oh, George.
Yeah. I think he really likes taking care of
Not being in any relationships survive a great dose of BD.
Yeah.
a fictional storyline. These are all actors. Was this information accurate? The simplest information?
What it could cause.
Yeah. Potential symptoms. At this time in the United States, because this is one of the first seasons, I think, of Grey's Anatomy, the prevalence of syphilis was accurate. This information was correct, and they tried very hard to make sure that they were disseminating information that was accurate about health. They also do really great things for representation to try to kind of cue into that social comparison theory where you are comparing yourself to the characters. And the media has also used this to try to aid in the effectiveness of these messages, and the effectiveness is based on two different things. Involvement, which is the level of personal identification we have with the specific characters, and then also transportation, the degree to which we are engrossed in a narrative. So how much you care that these two characters are sleeping together and now they both have syphilis, right? Will determine how effective this message is for you. But the media also takes advantage of transportation and identification with negative consequences. We've probably all seen programs like this.
Before you all step on the scale, there is something important that needs to be addressed. Last week, Jillian broke the rules and gave caffeine supplements to each member of her team without the doctor's permission. Because of this rules violation, Jillian has been penalized, and the white team will receive a 4-pound disadvantage on the scale tonight. 1 pound for each person on the white team. For fairness reasons, the last weigh-in is invalid. So tonight, the blue team will have the immunity that they won the previous week, and the eliminated player will return to the ranch tonight. So that means red team Ruben is back in this game. Jillian, before we move on, do you have something you want to say about what's happened?
I stand by my opinion. A caffeine supplement is significantly healthier than unlimited amounts of coffee. My only regret is that my team, they are the ones suffering the consequences of my professional opinion.
It's been 2 weeks since your last weigh-in. Now it is time to face the scale once again. Tonight, the person with the lowest percentage of weight loss on the losing team will fall below the red line and be automatically eliminated. Blue team, we are going to get you on the scale and see how you did. Bobby, we're starting with you.
Knowing that the blue team has immunity tonight is amazing. It guarantees automatically that we'll be here another week, and that's a great feeling.
The last time we weighed you in, you were 317 pounds. Your current weight is.
It's been 2 weeks since these guys have weighed in, but 19 pounds in 2 weeks. And I mean, this far along in the process, that's incredible. I love seeing these kind of numbers. These guys have been killing it in the workout, so of course they're going to have really good numbers.
I was really excited for my team, knowing that we can still pull big numbers. I feel like right now the blue team's unstoppable.
Matt, you lost 21 pounds for total percentage of weight loss, 5.7%. Blue team, you have immunity.
So what do we learn from shows like this? What did that clip teach us?
Rapid weight loss is okay.
Rapid weight loss is okay.
Caffeine pills are not.
Yeah, you can have as many caffeine pills as you want. They're better for you than as much coffee as you want. What else?
They still want.
There's a little bit of framing probably happening as well, right? Editing of the TV program. But you maybe know that, and there are other people who in the audience that maybe don't know that or realize that there is a lot of editing that happens in reality TV. They may take this as completely honest, right? And what does TV shows, reality TV shows like this, say about how we value people with health disparities, like obesity? Yeah. You are here for our entertainment. Okay? Yeah, they have to get half naked or partially naked in front of the country because they have a health disparity. Right? So they have obesity, right? They potentially didn't have access to proper nutrition. Maybe they had low socioeconomic status. We've been talking this entire time about how people who have social determinants of health, like low education, low socioeconomic status, specific races, genders, they are more likely to be unhealthy. So these people are more likely to be unhealthy, and now we're using them for entertainment. Okay? So, how can we integrate the ethical considerations that we talked about with Chapter 11 into things like news, advertisements, and entertainment education? How can we make these more ethical?
More accurate information, like being like, I don't know how to put it, but like just giving the right information, you know, not falsely, you know, giving information or deceiving or leaving, you know, things out.
Yeah. Avoiding deception, avoiding obfuscation of risks, which is kind of difficult, especially in advertisements, right? Where the point is they want to make money on this. That's why they are selling these things to you. That's why they spend $4.5 billion on advertisements. Absolutely.
Maybe making the visual kind of line up with the words for people who can't probably hear, like they can still hear it. If you ain't clear, you ain't hear.
Yeah, so making the channel more accessible, so different methods, not just TV advertisements, but maybe handouts or something in addition to that, as well as using that as an opportunity to teach them something. So instead of playing hockey, maybe we actually go over, this is what a red blood cell looks like, kind of scaled down to something that is approachable for the health literacy of our country. Absolutely. That was a great point. Anyone else? How can we make this more ethical? What about your role as providers?
Trying to find different ways on how to make this. Like if you know they're a college student, they eat a lot of junk food, because clearly I'm alone. You know, I shouldn't be on that show.
Yeah.
You can acknowledge a patient's curiosity, but at the same time say, like, I've seen that same thing. This is what I think.
Yeah, so making sure that you stay up to date on all of the media that's happening surrounding whatever your area of specialty is, so that you can have those discussions with your patients. Yeah. Any other thoughts? Okay.
About giving the patient, I guess, asking them what do they want, like what is it that you want or you think, so I can tell you what it actually is.
Yeah, so involving them in that information-seeking process rather than immediately shutting them down. Good. So, future directions. It will be your job to continue to assess how media, like the news, the advertisements that we saw, the entertainment clips, affects patient-provider communication, as well as providers, you need to acknowledge your role in providing ethical and accurate information to your patients in order to make sure that they receive the highest level of care possible. Right? So making sure that how we interact with the media and how they interact with the media really is the most accurate information so that they get the highest level of care. Any questions? Great, that's all I have for you. Thank you guys. I'll see you Thursday.